चलो आओ चक्कर डालना पड़ता ना। नो वहाँ पे मीटिंग चल रही।
Good evening, everyone. Good evening, sir. Can you hear me, sir?
Yeah, I can hear you. You can proceed, ma'am.
Yes. Good evening, everyone. I welcome all the Ayurveda participants to IIAS platform. IIAS is Integral Indianopedia Ayurveda School Arc. We have founded IIAS with the vision to provide excellent clinical and practical oriented educational platform for all the Ayurveda students and also the practitioners. We always try to give high level of knowledge and skills which are having scientific base, and we integrate it with Ayurveda and try to give the best to our participants so that the participants who step out from IIAS, they step out as a knowledgeable, competent, and caring Vaidyas by imparting the knowledge and skills that will encourage and enable practice of scientific base with high level of skill and social responsibility. We always try to create a wonderful teaching and learning experience which will help students to develop their own style and ability to use their own techniques. We also try to develop a deep sense of responsibility towards professional life while pursuing the education. This platform is purely for Ayurveda Vaidyas from all over the world. Today, in between us, we have the great Guru, Dr. Swapnil Gawande sir, who is exclusively practicing in pain and sports injury management since last 8 years. And today, he will be giving his all knowledge, his all experience with us. Let me introduce him. Sir has completed his BMS. After BMS, he has completed his diploma in DOMP from Japan. He has also done many certifications and post-graduation certifications in arthritic care. Also completed his fellowship in sports rehabilitation, MCMT from USA, COMT from UK. He has completed CFDM from Germany, CANS from Belgium, CALB from Australia. Apart from this, he is a founder and chief consultant of Spine and Joint Care Center from Ayurveda Multispecialty Hospital, Akola. He is also an honorable medical officer of Shiv Chhatrapati Kridapeeth Pune's Krida Prabodhini, Akola. Sir is also the founder of Ayurvada's Integrated Therapies of Rehabilitation and Training Academy, ISTART. He is practicing exclusively in this field from 8 years. Sir has gained all the knowledge from different parts of world, and in his practice at Akola, he has integrated our Ayurveda Siddhantas with this new concepts, and he is trying to give the best in his patients. And today he is in front of us to show how both the things in collaboration works and it gives best result to our patients. So as we won't be able to travel such a long to gain all this knowledge, we welcomed sir, and he was very keen to give his knowledge to the Ayurveda Vaidyas because he knows how much Ayurveda Vaidyas are struggling in this field. And today, pain and sports injury is a booming field for the Vaidyas. So, Dr. Swapnil Gawande sir, over to you. Please enlighten us.
Thank you very much, ma'am, for this nice introduction. It was actually very much elaborated and very much glorified. Thank you for this nice introduction. दोस्तों, आज का ये जो सेशन है, ये सेशन इंट्रोडक्टरी सेशन है जो कि मास्टर क्लास इन आयुर्वेद ऑर्थोपेडिक्स का कोर्स हम शुरू करने वाले हैं. तो फर्स्ट ऑफ ऑल थिंग, मैं आपके साथ कुछ छोटी बातें करना चाहूंगा, छोटी छोटी बातें करना चाहूंगा जो हम रोजमर्रा की प्रैक्टिस में डिस्कस करते हैं. क्या होता है कि आज आप सभी लोगों को पता है कि मैं ज्यादा थ्योरी में नहीं जाना चाहूंगा, सभी लोगों को पता है कि हाउ इम्पोर्टेंट इज पेन मैनेजमेंट नाउअडेज. और कितने सारे लोग, अगर आप आपके आजू बाजू में देख रहे होंगे, तो बहुत सारे लोग पेन मैनेजमेंट के लिए अलग अलग टेक्निक्स के साथ, अलग अलग थेरेपीज के साथ, अलग अलग मॉडलिटीज के साथ प्रैक्टिस में आए हैं. और आप सब लोग भी काफी यानी मैंने भी काफी स्ट्रगल किया है, और हर पोजीशन अपने शुरुआती दिनों में अपने चाहे वो मिड ऑफ द उसकी प्रैक्टिस हो या इनिशियल प्रैक्टिस हो, या बहुत 10 15 20 साल भी हो चुके हैं, तो भी हम ऐसे क्रिटिकल केसेस के साथ, ऐसे क्रिटिकल पेशेंट्स के साथ डील करते हैं जिनको हमें रिलीफ देना थोड़ा सा मुश्किल जाता है. So, what is basically the concept behind the multidimensional approach towards pain management is कि हमने स्पोर्ट्स इंजरी मैनेजमेंट में भी के इंट्रोडक्शन में भी ये लेक्चर में बोला था कि आजकल स्पोर्ट इंजरी इज नॉट रिलेटेड ओनली टू द स्पोर्ट्स पर्सन. आजकल काफी लोग फिटनेस फ्रेक हो चुके हैं, जिम फ्रेक हो चुके हैं, जिनको जिम जाना पसंद है. साइकिलिंग का बहुत ज्यादा क्रेज है, बहुत ज्यादा ट्रेंडिंग में है साइकिलिंग, जिमिंग, एक्सरसाइज, स्विमिंग. और बहुत सारे लोगों ने तो अपने घर में ही जिम बना रखे हैं. सो उनमें भी ये पार्ट आता है. उसके साथ साथ हमारा लाइफस्टाइल डिसऑर्डर्स भी हो चुके हैं. 9 to 5 जॉब, पहले जो एक कंसेप्ट था कि 9 to 5 जॉब, आज ऐसा नहीं रह चुका है. इफ यू आर वर्किंग इन अ कॉर्पोरेट, हमारे बहुत सारे पेशेंट जो है वो प्राइवेट सेक्टर में ज्यादा काम करने लगे हैं. उसके बाद में बिजनेसमैन है, हाउस वाइफ्स है, जिनके लिए कोई समय सीमा या कोई स्पेसिफिक टाइम नहीं है वर्किंग का. तो व्हाट एक्चुअली दिस इज हैपनिंग, ये सब जो हो रहा है तो इसका हमारे बॉडी पे, हमारे इस पे भी इम्पैक्ट हो रहा है. तो ऐसे बहुत सारी केसेस हैं जिनको हमें डायग्नोसिस करने में प्रॉब्लम आता है, जिनको हमें ट्रीटमेंट करने में प्रॉब्लम आता है. बहुत बार सारी मॉडलिटीज करने के बाद भी, जस्ट मिनट, जस्ट तो बहुत सारे लिमिटेशंस हमारे हैं. और इन लिमिटेशंस को, जस्ट सेकंड, सो बेसिकली फ्रेंड्स, ये जो डिफिकल्टीज है, इन डिफिकल्टीज को सभी लोगों ने कहीं ना कहीं पे कहीं ना कहीं फेस किया है. तो इनका एक वन स्टॉप सॉल्यूशन आज हम बात करने वाले हैं, जिसके बारे में इट विल बी अ वन स्टॉप सॉल्यूशन फॉर यू. सो लेट्स कमिंग टू द टॉपिक, दैट इज द मास्टर क्लास इन आयुर्वेद ऑर्थोपेडिक्स. तो जनरली क्या होता है कि आयुर्वेद ऑर्थोपेडिक्स में बहुत सारे केसेस ऐसे होते हैं कि जो क्रॉनिक होते हैं, एक्यूट होते हैं, सब एक्यूट होते हैं, जिनको हम हमारे अलग अलग मॉडलिटी से ट्रीट कर सकते हैं. लेकिन ट्रीटमेंट देने के बाद भी उनको रिजल्ट नहीं आता है. पंचकर्म कर लिया, अग्निकर्म, विद्यकर्म, वेदन कर्म, और कोई लेपन चिकित्सा कर ली, बद्ध चिकित्सा कर ली, लेकिन आफ्टर ऑल दिस ये सारी जद्दोजहद करने के बाद भी बहुत बार हमें वो रिजल्ट्स नहीं आते हैं, या वो हम पेशेंट को रिलीफ नहीं दे पाते हैं. तो इसका बेसिक रीजन जो मैंने इतने सालों में एक्सपीरियंस किया है, जितने लोगों से मैं आज मिला हूँ, जितने आयुर्वेद डॉक्टर से कॉन्फ्रेंसेस में, टीचिंग्स में, हमारे काफी सारे कोर्सेस हो चुके हैं जिसमें हमने लगभग 250 से ज्यादा आयुर्वेद डॉक्टर्स को पेन मैनेजमेंट में ट्रेन किया. इन सबसे बात करते हुए कुछ चीजें हमारे सामने आई. वो होता है कि डायग्नोसिस. और मैं इस डायग्नोसिस को कहता हूँ, आई कॉल दिस डायग्नोसिस एज अ डायग्नोसिंग एन एलिफेंट. Diagnosing a pain is just like diagnosing an elephant, and most of the time we diagnose it like the blinds, because lack of proper understanding, lack of proper integration, lack of proper broad spectrum view, uh, looking towards the that pain. So as you can see, all see in this particular image, you can see this, all these 6 doctors are diagnosing this elephant, and they are, and just imagine this elephant is the pain, and they are diagnosing it in the different way. Although it may be sometimes you take the video X-ray of a patient, and the patient X-ray is showing that there is the osteoarthritis, and the patient is having the osteophytes. So we start thinking about the osteophytes, and we think that the osteophytes are the reason behind the Janu Sandhi Shul or the pain in the knee or in the any other structures. If there is if patient comes with the USG, and there is a myositis, or there is a muscular pain, or the patient came with an low back X-ray or the lumbar spine X-ray, and hence it is written that there is a chronic musculospasm, we run behind or we go behind that particular radiological investigation. But sometimes it doesn't help, it doesn't make the sense by treating just that one element. So we have to diagnose the pain as a whole elephant and not as its organ or its part. So what are the basic parts? So here is a here you can see an image of a knee joint, because this knee joint contains the iliotibial band, the tibia, the muscles, the bones, cartilages, and all these structures. And whenever there is an injury, whenever there is a pain, it is not necessary that the pain is coming from only one element. जैसा ऐसा नहीं है कि सिर्फ मसल अगर स्पैजम दिख रहा है तो मसल से ही पेन आ रहा है, या एक्सरे में ऑस्टियोफाइट दिख रहा है तो बिकॉज ऑफ ओनली दैट ऑस्टियोफाइट ही पेन हो रहा है, या फिर कई बार एक्सरे में आता है कि देयर इज एक्यूमुलेशन ऑफ फ्लूइड या साइनोवाइटिस है, तो जरूरी नहीं है कि दैट एक्यूमुलेशन ऑफ फ्लूइड या फिर साइनोवाइटिस ही उस पेन का रीजन है, और भी कई स्ट्रक्चर्स वहां पे डिस्टर्ब हो सकते हैं. तो वी हैव टू अंडरस्टैंड दैट विच एग्जैक्टली, और अगर उससे एक से ज्यादा स्ट्रक्चर इन्वॉल्व है भी, तो उनको कैसे करके एक एक करके हम हमारे ट्रीटमेंट प्लान में इंक्लूड करें, कैसे हम उसका ये करें. तो फॉर एग्जांपल अभी घुटना देख ही लिया है हमने, तो घुटने का ये एक सरफेस एनाटॉमी का एक पिक्चर है कि फॉर एग्जांपल पेशेंट आपको एक पेशेंट घुटने का आ रहा है और वो बोल रहा है कि सिर्फ मुझे बी और डी एरिया में ही पेन है. I am just having a pain on the B and D area. Some patients come and they tell only that I am having pain and swelling only at the superficial suprapatellar region, that is the area which is denoted with the C. Some will tell you about the infrapatellar. Some will be unable to explain that how pain or where the pain is, but they will complain about the gross pain in the knee. So we have to find that in which particular area, or we have to make the differential diagnosis. If the patient is complaining about the pain in suprapatellar region, then what may be the probable cause, what may be the probable structures involved, and what are the modalities we should use in that particular condition. So this is the way of understanding we have to develop in our practice, so that we can go more precise and we can follow the more precise procedure to give the immediate, or if it is not possible, sometime immediate, earliest possible results to the patient. So basically, if we do that, there are two kinds of structures in our body, in our musculoskeletal. We called it as a musculoskeletal system, but if we go it as a gross, you can see that the bones are one thing, and the other soft tissues are the muscles, fascia, ligaments, tendons. Even in our mythological and our Sanhita Granthas, all our body has been divided into the Saptadhatus and the Kalas and other Srotasas. The body is content, or organ is formed from all these structures. So we have to go one by one, that is the muscle involved, is the fascia is involved, is the ligaments involved, is the tendon involved. And as per our routine practice, and we don't, I find that most of our Vaidyas, most of our practitioners are not well versed about all these conditions. And that makes the main issue in diagnosing the particular condition of the patient. So these all concerns which I have discussed now up till now, because the pain has multi dimensions, the pain has its different phases, because a pain is, first of all, you have to understand that the pain is not just a sign or symptom. You just cannot tell that. For example, if I am having a fever and I come to you in your OPD with the I came to you in your OPD as a patient and I am telling that doctor, I am feeling the feverish, मुझे बुखार आया है डॉक्टर साहब, तो what you will do, the first thing you will check with your touch, you will check my pulse, and then you have the tool that is called thermometer. You can put it into my below my tongue or into my armpit, and you will take the temperature and it will show that is there a real feeling of is there a real fever, is my body temperature is raised, or it is just the my feeling or my perception. But in regards of pain, we don't have such kind of tools. Because we cannot measure the pain into the numerical or qualitative or quantitative scale. So we just have to believe on what patient is telling us. I think you got my point. And the pain is a perception. If a patient with the two similar X-rays, a patient with two similar kind of structural deformity or the specific condition like osteoarthritis, the pain pattern, the pain symptoms, the pain signs, or the pain manifestation will not be the same. It will be always the different for each individual. So we have to make the protocols and we have to treat it individualized. And for that conditions, we have to go all three kind of parikshas like darshan, sparshan, prashna pariksha, and then we have to develop our broad spectrum view towards that particular pain condition, that which structure, which is the cause, because there are lots of factors which affect the pain, like age, like structure, जैसा हम बोलते हैं देश काल बल पेशेंट का ये करता है, उसकी स्थिति कैसी है, उसका सहत्व कैसा है, जिसको हम पेशेंट का सत्व कहते हैं. अगर हीन सत्व पेशेंट है तो शायद उसका पेन टॉलरेंस कम रहेगा, तो पेन टॉलरेंस अगर उसका कम है तो फिर उसका परसेप्शन पेन का ज्यादा रहेगा. तो माइट बी जो पेन कंडीशन में एक स्ट्रांग बंदा बोलेगा कि मुझे मॉडरेट पेन है, वही पेन कंडीशन, वही रेडियोलॉजिकल इन्वेस्टिगेशन और वही सेम कंडीशन में ही विल टेल कि आई हैव द सीवियर पेन. तो हमारे पास कोई ऐसा मीटर या पैरामीटर नहीं कि हम पेन को समझ सके. सो फर्स्ट ऑफ ऑल हमें करना पड़ेगा पेन को इंडिविजुअलाइज. तो फर्स्ट एक्शन जो हमें लेना है वो लेना है कि हमको पेन को इंडिविजुअलाइज करना पड़ेगा. हर पेशेंट को अलग अलग तरीके से देखना पड़ेगा और हमें एक नया पर्सपेक्टिव पर्सन सेंटर्ड पेन मैनेजमेंट का डेवलप करना पड़ेगा. सो एक नया पर्सपेक्टिव, एक नई विजन, एक नया चश्मा हमें बनाना पड़ेगा जिससे कि हम पेन की तरफ पर्सन सेंट्रिक पेन मैनेजमेंट को हम डेवलप कर सके और उसे ट्रीट कर सके. सो इट इज अ नीड ऑफ एक्शन, इट इज अ कॉल ऑफ एक्शन. सो हाउ यू कैन गिव अ कॉल टू दिस एक्शन. सो लेट्स अंडरस्टैंड कि जैसे आपने देखा होगा महाभारत में या पुराने जो हमारे सीरियल्स आते थे रामायण महाभारत में, वो अलग अलग तीर छोड़ते थे सामने वाले दुश्मन को मारने के लिए. एक तीर छूटा वो फेल गया, फिर दूसरा छूटा, फिर तीसरा किया. तो हमारे पास भी ऐसे बहुत सारे वेपन्स हमारे बैग में होने चाहिए, हमारी बहुत सारी स्किल्स हमारे पास होनी चाहिए पेन मैनेजमेंट को, कि इफ आइदर आवर वन और द अदर मॉडलिटी इज नॉट giving the result, we should develop the different skills. We should have the multiple weapons to tackle or to kill that devil called pain of the patient. So for that purpose, we have, as Dr. Manjusha has explained about me, I have learned lots of techniques, lots of modalities, lots of courses I have done after my BMS, and when I have decided to start my Ayurveda practice exclusively in pain, stress, and sport injury management. So I got the different perspective, and every time I learn something new, my hunger for the knowledge, my hunger for the this perspective is growing, and it has the long 8 years journey which I accumulated towards, and some of them I am going to share with you today. That myofascial release therapy, one of the things that is the myofascial release therapy, it's a very effective therapy. So what happens actually in the myofascial therapy? Myofascial release therapy is a type of gentle constant massage that releases that releases the tightness and the pain throughout your myofascial tissue. Myofascia is the fascia, is the myofascia or the fascia is an connective tissue which helps your body to bind. Fascia is the second largest organ of your body after the skin, which is um, which is actually covering all your tissues from the tissues to from the cells to tissues, tissues to organs, and organs to so every part of your body, internal body, is covered with this fascia, and it plays a very vital role into the pain conditions and also to release them. So first you will locate the trigger point or the knots of your facial tissues, and then you have to gently apply pressure until you feel the tension release. So if you feel the tension at particular point, you have to feel that trigger point and gently you have to release it. But yes, definitely for that you have to understand the facial distortion, how the fascia has distorted, and how you have to correct it. So it has got some principles, it had got some protocols. Okay, so myofascial release therapy also have some different kinds of modalities and different kinds of techniques to be done. That is like manual soft tissue mobilization, strain counter strain technique for the trigger point release, instrument soft tissue mobilization, and dry and gliding cupping methods. So, as you know, these techniques, which you can see in the pictures here, here with the help of this instrument, the facial release instrument, then the cupping, you know, and also this is the manual release in the right lowermost picture. You can see the manual release. So, these can be helpful, but you have to learn the specific technique. You have to learn about how to apply, when to apply, and how much time you have to do that. So what are the potential benefits? What are the basic benefits of the myofascial release that can help you to tackle the pain conditions, the fibromyalgia conditions in chronic pains, the pains causing to the old age, then the pelvic pain, particularly into the females after delivery, post-surgical conditions, scar tissue releases, abdominal surgeries, post-surgeries actually, not basically in the abdominal surgery. Post-surgical cases in the abdominal, postural dysfunction can also be corrected with the help of myofascial release. Also, chronic headaches can also be treated with the help of this myofascial release, using some facial release into your cervical and the cranial region. The chronic headaches can also be benefited. Then the dry needling. Dry needling is an extended form or the elaborated form of the Vedhan Karma. I personally called it as a Gambhir Vedhan Karma. Dry needling is used for the pain and movement issues associated with the myofascial trigger point and muscle knots. Whenever it is not possible to release the knots with these kind of modalities of the facial release, which we have seen in previous slides, we can use there the dry needling, because dry needling works on the both on the anatomical structures also, and also it helps into physiological correction or physiological manifestation of the pain, because it also interferes with the pain gate mechanism. Pain gate mechanism is the mechanism which regulates the pain conditions in your body, or which is the cause which make the patient pursue the pain and pursue the release of pain also. So with this technique, we insert a needle into a near or at the trigger point, and structure related to biomechanic facilitation of range of motion. For example, if a patient with the knee pain, or the obstructed range of motion, if the patient is not able to flex his knee, or if the patient is not able to straight his knee or extend his knee, he is feeling some or the other kind of obstruction, and after your palpation and after your examination, you find that there is obstruction in the quadriceps tendon or the hamstring tendon, then you can go and do the trigger point needling, and that trigger point needling will allow the patient, will make the patient move or flex or extend that particular structure like knee. So this is how needling can help in both the way physiological and anatomical also. The needle stimulate your muscles which cause them to contract or twitch. This twitch gives the release. This twitch gives the two different signals to your muscle. The first signal, the fascia, which is got uh, crease or which is got hard at the muscle, will got released because of that twitch, and the particular needle, the pricking sensation will give the message to your brain that there is something wrong, and the brain will send the nociceptors to correct that injury, to correct the or to release that spasm or that particular deformity in the muscle. So it will act in the both the way. So this is how the dry needling is a very useful technique. Most of the people ask about that, what is the difference between the dry needling and Vedan Karma? If we are doing Vedan Karma, then why we need the dry needling? So if in the left picture, you can see that with the help of the Vedan Karma, we can only reach up to the subcutaneous tissue or up to the dermis level of the skin. But with the help of dry needling, we can reach deep up to the muscles, deep up to the nerves, deep up to the medial muscles, because you know that in our body the muscles are being arranged in the multi-level: the medial muscle, the deep muscle, the medial muscle, and the superficial muscles. So we can, by using the different length of dry needles, we can reach up to the deep muscles also. So there are some misconceptions about the needling, that are needle safe, can needle make infection, can needle make injury to the nerve. But I would like to assure you that dry needling is a very safe practice if you do with very consciously and a proper knowledge. You should know that when you are inserting a needle into the spinal area, you should know that in which angle, at what level you have to insert the needle. If you are putting a needle at any particular muscle, you have to be very well aware that in which angle, at of which length needle you have to use. So when dry needling is applied to an affected muscle or a trigger point, it can decrease muscle tightness, increase blood flow, and reduce the pain. Okay, that's what I have explained earlier. I would request to all the participants that please don't put any messages till the presentation end, because it disturbs. So patient often report immediate relief of the pain, and that's what I am telling, that as you can give the immediate pain relief with the help of Agni Karma and with the help of Vedan Karma, like that also you can give immediate relief from pain also, and from the obstructed range of motion also. Then about the misconception, I would say that dry needling is a safe technique for treating many musculoskeletal conditions, including shoulder pain, rotator cuff, bicep tendonitis, iliotibial band syndrome, Achilles tendons, low back pain, and many more conditions. Also, it can helps in improving the immunity also. Okay, moving further. The next technique or the manual therapy which can you include into the pain management, or which can be a very much good weapon, that is the osteopathic articulation. Osteopathic articulation are referred to the mobilization and manipulation of the joints through the process through the process. So more than is implied that, sorry, I will read the statement straight away. Osteopathic articulation refers to the mobilization and manipulation of the joints, although the process achieves so much more than is implied by that statement. देखिए, ऑस्टियोपैथिक आर्टिकुलेशन को पहले कहा गया कि मोबिलाइजेशन और मैनिपुलेशन टेक्निक होती है, लेकिन सिर्फ उससे ही उसका वास्ता नहीं है, उससे ही सिर्फ उतना फायदा नहीं है, उससे बहुत ज्यादा फायदा होता है, क्योंकि फॉर एग्जाम्पल एज फॉर एग्जाम्पल अगर कोई बॉडी पार्ट में स्वेलिंग है, फॉर एग्जाम्पल अगर रिस्ट में स्वेलिंग है और हम रिस्ट, द पेशेंट इज टेलिंग कि रिस्ट मेरा मूव नहीं हो रहा है और इट इज वेरी पेनफुल टू मूव द रिस्ट, तो अगर ये रिस्ट मूव नहीं हो रहा है, फ्रीज हो चुका है, ये ऑब्स्ट्रक्टेड हो चुका है, और अगर आप इसको उसके रेंज में जहां पे टॉलरेंस है पेशेंट का, ऐसा भी अगर आप उसको मूवमेंट चालू करोगे तो धीरे धीरे ये मूवमेंट बढ़ेगा और पेन सेंसेशन कम होगा, बिकॉज इट विल अलाउ द ब्लड सप्लाई, नर्व सप्लाई टू regulate, and that will gradually reduce the pain sensation, pain conditions, and also patient will be feeling more confident psychologically. Okay, there was no movement, but now I can move a little bit, and that will help us to get benefit or to get the help from his immune system in treating the such kind of patient. Okay. uh, it can be used to treat wide range of application, like musculoskeletal pain, hypertonic muscle, osteoarthritic joint changes, and decreased range of movements. Like in you may have gone through the patients which are struggling with walking, stepping up, stepping down, or the patient of the osteoarthritis which have the limited range of motion, the patient with the shoulder joint pain, the patient with the ankle joint pain where उनका रेंज ऑफ मोशन कम हो चुका है, तो ये सारे जॉइंट केसेस हम ऑस्टियोपैथिक आर्टिकुलेशन, लेकिन इसके भी कुछ प्रिंसिपल्स है, उसके भी कुछ एंगल्स है, बिकॉज यू हैव टू अंडरस्टैंड कि अगर एक पर्टिकुलर मूवमेंट नहीं हो पा रहा है तो व्हाट आर द पॉजिटिव सेक्शन, जैसे मैंने पहले बताया कि क्या ये इसको मसल ऑब्स्ट्रक्ट कर रही है, क्या इसको टेंडन ऑब्स्ट्रक्ट कर रहा है, और उस हिसाब से आपको ऑस्टियोपैथिक आर्टिकुलेशन करना पड़ेगा। अदरवाइज क्या होगा कि आप उसका नुकसान कुछ नहीं होगा, बट आप उसको वो डिजायर्ड रिजल्ट नहीं दे पाओगे, और हो सकता है कि अगर आपने गलत आर्टिकुलेशन कर लिया तो पेन बढ़ भी सकता है। तो फॉर दैट वी हैव टू गो थ्रू प्रॉपर अंडरस्टैंडिंग ऑफ द ऑस्टियोपैथिक आर्टिकुलेशन। उसके बाद में ऑस्टियोपैथिक आर्टिकुलेशन कैन रिस्टोर द मूवमेंट एंड डिक्रीज द पेन टू योर अफेक्टेड जॉइंट्स बाय यूज ऑफ स्लो लो की मैनिपुलेशन टू द प्रॉब्लम जोन, वर्किंग विद योर पेन फ्री रेंज ऑफ मोशन so that not cause the further discomfort। ये मैंने आपको पहले ही एक्सप्लेन कर दिया कि अगर आप उसके ही रेंज में मूव करना शुरू करोगे तो पेन भी कम होगा, एंड हाउ इट विल आई हैव ऑलरेडी एक्सप्लेन। सो आपके अंडरस्टैंडिंग के लिए, आपको थोड़ा सा समझ में आए कि कैसा काम करता है, इसलिए मैं आपको ये एक एक्सरे दिखाना चाहता हूं, जो लेफ्ट साइड में आप देख सकते हो कि शी इज अराउंड 70 ईयर ओल्ड पेशेंट, जिनमें हम हार्ड मैनिपुलेशन, कायरोप्रैक्टिक या अदर कोई फिजिकल मैनिपुलेशन नहीं कर सकते हैं। तो इन दैट कंडीशन हमें ऑस्टियोपैथिक आर्टिकुलेशन कैसा हेल्प करता है। तो इस एक्सरे में आप अगर देखोगे तो देयर इज लॉस ऑफ लंबर लॉर्डोसिस भी आपको दिखेगा, और यहाँ पे देखिए पेशेंट को डिजेनरेटिव चेंजेस भी है ओल्ड एज पेशेंट होने के कारण, तो लॉस ऑफ हाइट भी है, क्योंकि ये ओल्ड फ्रैक्चर भी हो सकता है पेशेंट का। तो इस वीडियो में आप देख पाओगे कि मैं किस तरह से पेशेंट को आर्टिकुलेट कर रहा हूं लंबर पे। तो ये क्या कर रहा है कि जो रेंज ऑफ मोशन, जो स्पैजम है, जो लॉस ऑफ लंबर लॉर्डोसिस की वजह से जो पेशेंट को तकलीफ हो रही है, वन मोर टाइम आई विल प्रे फॉर यू। तो दिस इज हाउ आई एम गिविंग द पर्टिकुलर स्पेसिफिक आर्टिकुलेशन टू द पेशेंट। यहाँ पे सबसे जरूरी है कि मैंने हाथ कहाँ रखा है, क्योंकि मैं जहां पर हाथ रखूंगा, मुझे जहां पे आर्टिकुलेशन देना है, जिस वर्टेब्रा का आर्टिकुलेशन देना है, आपको वो समझना पड़ेगा। ओके, देन कपिंग एक बहुत अच्छा टूल है मायोफेशियल रिलीज के लिए और पेन मैनेजमेंट के लिए, क्योंकि वो बहुत सारे अलग अलग तरीके से हम उसे यूज कर सकते हैं। बहुत सारी मॉडलिटीज कपिंग की है, जो कि हम इस मास्टर क्लास में कवर भी करने वाले हैं। जैसे ड्राई कपिंग, आप सभी को पता है, उसे ड्राई कपिंग इसलिए कहते हैं क्योंकि वहां पर हम कोई लिक्विड या ये नहीं यूज कर रहे हैं, वी आर जस्ट अप्लाइंग द स्किन ऑन दी ड्राई स्किन, जो कि वहां का फेशियल रिलीज भी करेगा, जो कि वहां का फेशियल रिलीज भी करेगा। देन हम वेट कपिंग कर सकते हैं, जिसको हम अलाबू भी कहते हैं, प्राक्षान कर्म करके अलाबू के जैसा फिट करके हम स्थानिक जगह से कपिंग ये कर सकते हैं। उसके बाद में फायर कपिंग होता है, डायनेमिक कपिंग होता है। अभी फायर कपिंग भी आप सब लोगों को पता होगा, बहुत सारे लोग मुझे पहचानते हैं कि ये तीन, बहुत सारे लोग मुझे पूछते हैं कि सर ये डायनेमिक कपिंग क्या है और ये कैसे काम करता है। तो डायनेमिक कपिंग के लिए आपको पहले तो समझना पड़ेगा कि किस मसल्स की वजह से, किस स्ट्रक्चर की वजह से, किस स्ट्रक्चर की वजह से हम ये कपिंग जो है कहाँ पर करना चाहिए। तो फॉर योर सेक ऑफ अंडरस्टैंडिंग, ये पेशेंट था हैमस्ट्रिंग स्ट्रेच का, इसको हम डायनेमिक कपिंग मूवमेंट दे रहे हैं। तो हमने ऑस्टियोपैथिक आर्टिकुलेशन और डायनेमिक कपिंग इन दोनों को इंटीग्रेट करके एक नई सिस्टम, डायनेमिक कपिंग और सॉरी कपिंग और ऑस्टियोपैथिक आर्टिकुलेशन, इन दोनों का कंबाइन करके हमने ये डायनेमिक कपिंग मेथड डेवलप किया है, जिससे कि द पेशेंट का जो सुपरफिशियल फेशिया तो रिलीज होगा ही होगा, लेकिन अगर उसकी डीप मसल भी अगर स्ट्रेन्ड है या डीप मसल भी अगर कोई प्रॉब्लम में है, तो देन इट विल आल्सो गेट बेनिफिटेड फ्रॉम दिस। तो पोटेंशियल बेनिफिट क्या होते हैं कपिंग के? कि रिड्यूस पेन एंड इन्फ्लेमेशन, डिक्रीज मसल टाइटनेस, improves blood flow, it also increases range of motion, also gives benefit of घटी यंत्र, रक्त मोक्षण and मर्दन कर्म. If you find that there is the absolute indication in particular disease, then you can use it as like a Ghati Yantra. In Gulma, you can use it as a Ghati Yantra. In Rakta Drushti, in gout, in Rakta Pitta, Vat Rakta, you can use it for Rakta Moksha. And where there is a deep facial discomfort, or if you need or you find that the patient needs the deep tissue massage or the deep facial release, then also you can use the gliding method. Where there is a absolute indication of the mardan, you can also do the mardan with the cupping. So we have to also innovate. We have to also develop some of the integrations for our classical upakarmas, for classical panchakarmas like Raktamokshan. Here you can see on the right side, this is for the sake of your understanding only. The actual process has been done into the Panchakarma room, but for your sake of understanding, we have shown this picture. You can see that here is the below knee traction, where the traction is applied on the both the knee of the patient with the specific weight according to the age and according to the bala of the patient, and we can attach here the Janubasti Janubasti pots, and we can pour the oil in this, so that what will happen, that the soft tissues, what we are actually the soft tissues will be pulled, and if there is a strain, there is a fibrosis, or there is a fibromyalgia, that will also release because of that traction. And also the benefits of Janubasti, you all know that it is a Avga Swed, so it is giving both the Swedan and the Bruhan also. It is also doing the Snehan and also giving the Bruhan, and also having the effect of the Swedana. So it has a multidimensional already. And in this particular picture, you can see that the Janubasti is going on, and there is the instrument. So this instrument is basically a laser light instrument, and we are giving that laser to while performing. It is a laser blower. It is a dual action. It also blows the hot air and also emits the laser light, and hence you can see that the blue light this blue light, you can see that blue light is the emission of the laser light. So we are also giving the laser, because with the help of laser we can go deep up to the tendons and the meniscus and the synovial fluid, so that We can give the Gambhir Swedan also. The Swedan to the Gambhir structures like the deep structures like ligaments, the tendons. So we will also share in this course some of the innovative panchakarmas, how to perform them, how to practically use, how to set protocols for this particular, because we have to make sure that we are not going to harm the patient. Then along with all these things, we are also covering the basic understanding of the functional anatomy, that um, how our joints move, how what are the elements involved in the movement of the joints, what are the muscles, tendons, and how can we understand that where to treat while there is a pain in the particular joint. Then also we are going to discuss lots of things about diagnosis, that is clinical, radiological, pathological, the general terms, general symptoms, and also the specified pathological findings we are going to see in this master class. Also, we are going to cover the Marma Chikitsa, that how effective is the Marma Chikitsa. You all know, so how to apply Marma Chikitsa. Also, the Bandha Chikitsa, that is bandaging, different kinds of bandaging, the classical Ayurveda bandaging, the therapeutic bandaging, the kinesiology taping, and so on. Also, Agni Karma and Vedan Karma are also, we are going to discuss that when to use the Agni Karma, when to use the Vedan Karma, how to use. We are going to discuss about the Agni Karma and Vedan Karma also, which are the conditions which can be benefited with these particular modalities. So what you are going to learn about this pain management masterclass or the masterclass in Ayurveda orthopedics. I have listed it down what we have discussed up till now, that is the functional anatomy, diagnosis, Marma Chikitsa, Bandha, Agni Karma, Vedan Karma, cupping, all forms of cupping, innovative Panchakarma, posture correction, myofascial release, different techniques, all the different techniques which I have learned from all over the world. I am going to share with you the Gambhir Vedan, that is the dry needling, trigger point therapy, osteopathic articulation of the spine and joints, instrument assisted soft tissue mobilization, muscle energy techniques and rehab protocols, diet and nutrition protocols, and so on. You are going to see we have fully loaded this Ayurvedic masterclass, this masterclass with the specified the super specialty branch of Ayurveda orthopedics. So friends, this masterclass in Ayurveda orthopedics is a 6-month comprehensive orthopedic course for Ayurveda doctor. It's exclusively for Ayurveda doctors. We are not entering any other people in it. So how is this course designed? I will just in short, we will explain. We have designed it into 12 modules. Approximately each module will be completed in 1 week, 1 to 2 weeks. Some of the modules will take a longer time. So in the module 1, we are going to have the first lecture tomorrow itself. So you have the only 24 hours right from now. Now I can say that only 23 hours remaining for the first class, because tomorrow at 9 p.m. it will be the first introductory session. Onboarding session is going to happen of this course. In the module 1, we are going to cover the general anatomy of the Sapta Dhatu and Kala, how to correlate the Sapta Dhatu with the modern anatomical structures which we have learned. Also the functional anatomy of spine and bones. Then we are going to, into second module, we are going to see the physiology of the pain, or that is called as the pain gate mechanism, the Ayurveda Vat Vichar, that how we can correlate pain gateway mechanism and different kinds of pains and different symptoms of the pain with the Ayurveda Vat Vichar, the classification of the pain according to modern and to also according to modern and according to Ayurveda and modern, sorry for the slip of tongue. वात रोग की सामान्य विशेष चिकित्सा और उसके सिद्धांत क्या होने चाहिए, हमने किस पर्सपेक्टिव से देखना चाहिए, जो कि हमें इजी करेगा कि कैसे मॉडर्न टर्मिनोलॉजी को हम आयुर्वेद टर्मिनोलॉजी के साथ कोरिलेट कर पाए और एक स्पेसिफिक डायग्नोसिस के लिए एक स्टैंडर्डाइजेशन बना पाए. बहुत बार आयुर्वेद डायग्नोसिस कुछ और कहता है, मॉडर्न डायग्नोसिस कुछ और कहता है, और फिर हम थोड़ा सा कंफ्यूज हो जाते हैं। तो ये कंफ्यूजन भी हम इस मॉड्यूल में कवर करने वाले हैं। उसके बाद में थर्ड मॉड्यूल में हम क्लिनिकल डायग्नोसिस, पोस्चरल एनालिसिस, रेडियोलॉजिकल। तो बेसिकली थर्ड मॉड्यूल में हम डायग्नोसिस के बेसिक प्रिंसिपल सीखने वाले हैं, इन डेप्थ हर चीज होने वाली है। चौथे मॉड्यूल में हम पंचकर्मा, अलग अलग पंचकर्मा, मॉडिफाइड पंचकर्मा, और इसमें ही हम वेदन कर्मा भी लेने वाले हैं। फिफ्थ मॉड्यूल में हम कपिंग, बंध चिकित्सा, काइनेसियोलॉजी, टेपिंग, मायोफेशियल रिलीज, इनके सारे टेक्निक्स। माइट भी चौथा और पांचवा मॉड्यूल थोड़ा ज्यादा लंबा होगा, शायद 2-3 हफ्ते चलेंगे। छठे मॉड्यूल में हम सीखने वाले हैं कि ट्रिगर पॉइंट थेरेपी क्या होती है, मर्मा क्या होता है, ऑस्टियोपैथिक आर्टिकुलेशन जो हमने अभी देखा, और सॉफ्ट टिश्यू मोबिलाइजेशन के डिफरेंट टेक्निक्स क्या होते हैं। उसके बाद में हम मॉड्यूल 7 से हम ऑर्गन बाय ऑर्गन जाने वाले हैं। जैसे 7th मॉड्यूल में हम कंप्लीटली स्पाइन को कवर करेंगे, सर्वाइकल, थोरेसिक, लंबर और पेल्विक गर्डन तक। तो शायद 7th मॉड्यूल पूरा महीना ले लेगा, क्योंकि हम हर चीज को इन डेप्थ सीखेंगे, उसका डायग्नोसिस, उसका ट्रीटमेंट और उसका रिहैब। हर जॉइंट का अलग अलग हम सीखने वाले हैं। तो आपको क्या होगा कि ये हर मॉड्यूल आपके लिए एक पर्टिकुलर कंडीशन, फॉर एग्जांपल अगर सर्वाइकल पेन का पेशेंट आपके पास आ रहा है, तो इसके लिए आपके पास वो पूरा मॉड्यूल होगा, फ्रॉम डायग्नोसिस टू ट्रीटमेंट। तो आपको पूरा ढूंढना नहीं पड़ेगा कि हमें कहाँ ढूंढना है, व्हेन यू हैव टू रिकॉल इट। 8th मॉड्यूल में हम अपर बॉडी के जॉइंट्स लेंगे, 9th मॉड्यूल में लोअर बॉडी के जॉइंट्स लेंगे। 10th मॉड्यूल में हम कुछ स्पेसिफिक कंडीशंस, जो कि ऑटो इम्यून कंडीशंस बोलते हैं या रोमेटिज्म कंडीशंस जो बोलते हैं, उसके अलग अलग टाइप्स, जैसे रोमेटिज्म, एंकोलिसिस, ये करेंगे। और 11th मॉड्यूल में हम कुछ स्पेशल कंडीशंस, हो सकता है इसमें से मैं मेरी तरफ से तो कुछ स्पेशल कंडीशंस ऐड करूंगा, लेकिन तब तक कि हम काफी हद तक काफी चीजें पढ़ चुके होंगे। तो अगर आपके पास भी कोई स्पेशल कंडीशंस की केसेस आती है, तो उसके बारे में भी हम यहाँ पे स्टडी करने वाले हैं। और मॉड्यूल 12 में हम पढ़ने वाले हैं द लास्ट पार्ट, दैट इज डाइट, न्यूट्रिशन, यमिटी फॉर योगा। यमिटी का लॉन्ग फॉर्म होता है मसल एनर्जी टेक्निक्स। स्पेसिफिक बॉडी पार्ट के लिए, स्पेसिफिक जॉइंट के लिए किस तरह के, एक बार हमने ट्रीटमेंट तो कर दी, लेकिन उसको अपुनर्भव भी हमें देना होगा। तो वो अपुनर्भव के लिए हम यहाँ मोडेलिटी यूज करेंगे, योगा और रिहैब, जो कि हमें उनको घर पे बोलना है। तो इसके लिए क्या है, इसके साथ साथ में काफी सारी आपको होम रेमेडीज जो आप आपके पेशेंट को बोल सकते हो, छोटी मोटी चीजें जो आप पेशेंट्स को बोल सकते हो कि भाई ये अगर आप करोगे, जो टिप्स आप दे सकते हो, जिसकी वजह से अपुनर्भव चिकित्सा का आपका काम पूरा होगा। इसी के साथ हम डाइट एंड न्यूट्रिशन के लिए भी डिस्कस करेंगे, और शायद इसके लिए हमारे साथ एक बहुत अच्छे डाइटिशियन भी जुड़ेंगे। सो थैंक यू वेरी मच फॉर दिस। तो अभी काफी लोगों ने बीच में ही पूछ लिया था कि कितनी फीस है, क्या है, तो मैं जल्दी से आपको उस चीज पे भी आता हूँ। सो बेसिकली मेरे बारे में डॉक्टर मंजूषा चित्ते ने ऑलरेडी बोल ही दिया है, लेकिन जो लोगों ने लेट ज्वाइन किया उनको मैं बोलना चाहूंगा कि मेरा नाम डॉक्टर स्वप्निल गावंडे है। आई हैव कंप्लीटेड माय BAMS, आई हैव कंप्लीटेड माय DOMP, दैट इज पोस्ट ग्रेजुएट डिप्लोमा of osteopathic manipulative practice from Japan. I have also done the postgraduate diploma in arthritic care. I am pursuing the fellowship in sports rehab. I have done MCMT from USSUMT, and I have done all the other stuffs from world's renowned physicians, world's renowned trainer in pain management. These all are my gurus. These all are my trainers. You can see all, from all over world. I will start from Dr. J. Amata. He is our principal and the main tutor of DOMP from Palms Osteopathic College, Japan. From where the Japan Health Association, I got the degree. This was my picture with him, having my degree of DOMP. After uh, after the completion, after our graduation ceremony, this is Dr. Kostopoulos and this is Dr. Rizopoulos. Sorry, this is Dr. Rizopoulos and this is Dr. Kostopoulos. They are from MCM Hands-on Institute in New York, USA. So from where I have completed my mastery certificate in manual therapy, I would like to also take a pride of that I am the only Ayurveda doctor in the India. I am the only Ayurveda doctor in India who possess the degree of mastery certification in manual therapy from HOS Institute, New York, Japan. All others are either physical therapist or the pain management specialist. I am the only BMS there. And all others are also the legends, the Gils Geyer, the Tom Mayer, Arshad Sir, the Thorsten Fisher, and all other people's, the great teachers all over the world. So all this cost me around 20 to 25 lakhs, but we are offering this course at the cost of only 10% of my investment or 10% of my spending. That is to 20,000 only. And this is as this was a scheduled lecture and I was aware, so I was not aware that this was the last lecture of our series, which we have running from last 2 months about the Ayurvedic orthopedics. And we have committed that in on the participants who are attending these lectures of this orthopedics lecture series, we are going to offer them the fee, that is the 15,000. The another offer is already closed down at 15th of June. So this offer is not valid. You have to pay full amount now. That will be 15,000. That will be 15,000, and it believe me, Fox, that you are not going to lose anything. You are not going to lose a single penny, because we are giving the mega bonus. This mega bonus is also for the limited participants. I think that Dr. Manjusha or Dr. Lalit will elaborate it, that how much seats we have remaining for this 2 days offline workshop, hands-on training workshop, which is going to be absolutely free along with this. But the accommodation facility is not there now, because we have already done with the admissions. We have already done with the, but definitely we are going to give you the free access to this 2 days offline workshop. So friends, thank you very much for listening me calmly, carefully. I am now going to unmute. I am now allowing you all to ask the question. You can also ask the question on, if you have any queries regarding the Ayurveda orthopedic practice, or if you are having any of the queries regarding this particular course. Dr. Manjusha Madam, if you are there, you can also elaborate and acknowledge the peoples regarding the remaining seats. Yes, sir. Do you want to ask something?
Hello.
Yeah, one, please. Yes.
Yes, sir. Can I ask one question, sir?
Yeah, ma'am, please.
Yeah, myself, Dr. Jasmine. I am from Pune. So I wish to ask you, sir, that can we treat bilateral TKR patients with Ayurveda treatment? Like, what can
Definitely,
we?
ma'am.
Because see, after TKR also they have pain. It's not that they are completely pain free, right? So what can we do through Ayurveda treatment?
Madam, TKR patient, first of all, that's what I am telling. That first of all, if there is a pain, so you have to first understand that after TKR, what happened? What happens in the TKR? क्या हुआ TKR में? TKR में cartilage change हुआ है. उनको जो incision दिया गया है, that incisions has now developed the scar tissues. And also, अगर आपने lecture पहले से सुना होगा, तो I have discussed about lots of soft tissues. तो हो सकता है वहां पे facial distortion हो सकता है कि जो scar वहां पर है, वो scar की वजह से वो मसल या वो पर्टिकुलर स्पेस जो है वो शॉर्टन हो चुका है, एंड दैट इज गिविंग पेन. तो फर्स्ट ऑफ ऑल यू हैव टू मेक द प्रॉपर डायग्नोसिस. देयर इज नो, ऐसी कोई भी कंडीशन नहीं है जिसको आप आयुर्वेद के द्वारा ट्रीट नहीं कर सकते. यू कैन ट्रीट एवरीथिंग. आई हैव लॉट्स ऑफ पेशेंट. I have lots of patients कि
आ जाएगा
जिन्होंने sir only unmute those people who want to ask question. So
The person is my father only, and he
okay.
got operated near about 8 to 9 years back. So
Yeah.
his injury, I mean, post surgical scarring and all that is all okay, but still he is having pain.
No. Scar is okay. What do you mean by scar is okay? If that internal scar is obstructing the muscle to stretch out, then how it is okay? So we can do the scar needling, we can do the myofascial release around that particular scar. If you want to discuss particular case, ma'am, you can connect with me personally because it will take lots of time to.
Sure, sir. Sure. I'll
Yeah,
get the number and I'll personally contact you. Yes.
yeah, definitely.
Thank you so much.
Then somebody, Dr. Prabhakar Hegde had asked a question, sir, why the time period of the course is 6 months? Is it not be able to complete in 1 to 3 months? Sir, it is not possible because we are going to cover a huge amount of the curriculum. ये ऐसा नहीं है कि मैंने आपको कुछ तो भी सिखा दिया कि ऐसा कर लो वैसा कर लो and that. I am just not teaching or I am not going just to share the techniques. I am going to share you the thorough anatomy of that particular part, the thorough possible diseases, thorough possible conditions. As the Jasmine madam was discussing about her father, that the scar is okay, but I have got the patient which the scar is one of the most important part or one of the most important reason behind the pain, the chronic pains. Most of the ladies, you will agree with me that most of the female patients who have undergone the LSCS have the pain in their lower back, and most of the females think that that lower back pain is because of the anesthetic injection which was given in their lumbar vertebra. But no, the most common reason for the lower back pain into the patient after LSCS is the LSCS scar. Though it is not in the back, it is into the front side, but the main reason is that scar tissue which is causing the discomfort into the lower back, into the pelvic floor. So this is called as a regional interdependence. So we are going to understand the regional interdependence of all the joints also one by one. That's why, yeah, the class will be at Monday, Tuesday, and Wednesday every week. 9 to might be 9 to 10 or 9 to 9:30 p.m. If there are some technical issues or if I am not available in these days, then it will be postponed to consecutive days of the Thursday or Friday, because so that you don't have to waste your weekends. Also there will be the recordings available if you miss some of the class. Okay, Dr. Maniar madam, you lost the starting lecture. You can go on to the Ayurveda Wellness, and there you can YouTube channel Ayurveda Wellness, and there you can see the live streaming that will be available after some time of this lecture. Also, recording will be there into the groups. Yeah, Dr.
Sir,
Neetu Agarwal.
I wanted to ask one question.
Yes, sir.
Is there any scope for AVN, avascular necrosis of hip joint?
So first of all, that's what I am telling, that first of all you have to understand the manifestation of the AVN, that why AVN has happened. If you have listened, we are going to cover the conditions of the hip joint pelvic girdle also. So in the AVN, what happens actually, there is what is the long form? A vascular necrosis. So what necrosis? Necrosis is a decreased blood flow, blood supply to the hip joint. AVN, though the AVN of the hip joint is very common, but AVN can happen at any joint. There are the cases with the AVN of the shoulder joint. There are the cases with the AVN of the knee joint is also common.
Yes, sir.
In the AVN, we have the different aspect of manual therapy. With the help of manual therapy, you can give the release or you can give strengthen to the peripheral structures which are supporting the hip joint. For example, your gluteal muscles, your quadricep muscles, your hamstring muscles, your core muscles like iliotip, sorry, your core muscles which are holding the hip joints.
Yes, sir.
We can help it out by releasing the pain, by postponing his operation. Also with the physical medicines, with the Ayurveda medicines like Raktavardhak Chikitsa, we can also help him with the regeneration of the cells.
Okay, sir. Thank you very much.
Yeah. Yes. Please keep class in daytime. Earlier you said for the daytime. Rohit Arora sir, yeah, we have taken the lots of people are the practitioners here. So might be we can keep the query session into the daytime, because most of the time there are lots of practitioners in the course which are enrolled for the course are the practitioners, and it is very uncomfortable for them to do the class into the afternoon. Also, it will be very much disturbing for my own practice, because I am not the hardcore teacher. I have to look after my patients also. So if there comes any emergency during the class, then I have to disturb that class. So it will not be that beneficial. If you miss some of the other class because of your duty or because of any other cause, you can see the recording and you can ask your query into the query session. Dr. Manjusha or Dr. Lalit, if you are any of you is there, please put the details into the chat box so that just a minute, I will share the numbers of organizer. You can take the screenshot. Okay, so this is the these are the contact details of Dr. Manjusha and Dr. Lalit Heda sir. So you can take the screenshot of this slide. Any questions? These are the bank details where you have to put the fees. Okay. Any questions? All who have missed the starting of the class or initial slides, they can watch it on the Ayurveda Wellness. I will paste the link into the link of the class. I am giving it to the chat box. So you can see from there also if you have missed something. Any questions? If there are questions, I am here for next 2 minutes. No questions?